This webinar is how to fly during COVID-19. Should you just avoid air travel altogether? What if you have to fly? What's the best way to do it safely? Is it enough to wear a mask and use hand sanitizer frequently? This webinar is conducted with MedCan's Dr. Aisha Khatib. She's the Clinical Director of Travel Medicine. I'm Christopher Shulgan. I create content here at MedCan. Let's talk about Dr. Khatib's bio. Dr. Khatib is an assistant professor in the Department of Family and Community Medicine at the University of Toronto. She currently works as a staff physician at St. Michael's Hospital and as a medical assessor at one of the COVID-19 assessment centers in Toronto. She's also the clinical director of the Travel Medicine Clinic at MedCan. Dr. Khatib, how are you today?
I'm great, Chris. How are you doing?
I'm good. I hear you have a vacation coming up, your first time, you said, in more than a year that and I think it's more of a staycation, but anyway, you're taking some time off. When?
I'm going to drive out to a cottage in Quebec on Thursday, so that'll be nice. But made sure there's no internet for at least 4 days.
Nice.
Really, what we're going to talk about today is risk, and what is the risk associated with the future of air travel in the COVID era. So I'm going to start off by just talking about, wait, can you see the screen there, Chris? There we go. So the whole idea in travel medicine is looking at risk and basically doing a risk assessment for every traveler. We look at basically estimating the baseline risk to a traveler and then considering the factors that may modify that risk specific to the individual, but also considering the role of other interventions to decrease risk. And then also then accounting for a traveler's perception and tolerance of risk, which, as we see by the poll that you guys all just did, that perception and tolerance of risk is very variable depending on people's perception, on their comfort level, and perhaps on the understanding of the facts. One of the things in regards to flying in the current climate of COVID-19 and the pandemic is that there really is a zero risk scenario when it comes to flying during the pandemic, okay? So when we talk about risk, there's a couple different risk situations that are variable when you're actually flying through air travel. So one is actually looking at exposure risk. So what is your risk of being exposed to somebody with positive COVID-19 while on an airplane? This is actually a website from the Government of Canada which shows potential or shows basically flights that have had positive cases, and anyone can go and look this up. But if you actually look at the number of cases that have been occurring, basically we're seeing at least per day 1 to 2 flights with a confirmed COVID-19 case on board. So if you look on the left side, this is all on the website, but basically domestic flights in the last 2 weeks, and then if you look at international flights, and this is just for July, but you can actually look back at the data going back into June, and it's very similar. Now, I wasn't able to get the actual details of how many flights are going, so comparatively, if we're looking at 1 to 2 flights per day with a COVID case being reported, out of how many flights that are going, of course, flights are very limited right now. And then if we look at the difference between that and transmission risk, so what is the risk of actually contracting COVID-19 while traveling on an airplane or during air travel? That's actually a lot more difficult to quantify currently. And the reason for that is there are a lot of different variables that come into play. For example, the biggest one would be the risk of asymptomatic or pre-symptomatic spread, meaning that people may be able to transmit COVID-19 while they're not symptomatic. The density at which the airplanes or the airports are full, and we know that one of the mainstays of public health recommendations is distancing, and knowing that on an airplane it is very difficult to distance. Screening by airports and airlines is another variable, and these are very different. And, it depends on how many potentially symptomatic patients or patients who may be at risk of transmitting are being picked up by airlines and prevented by being onto the airplane, as well as the origins of flights. So if you're looking at places where travelers are going from an area of higher density infection or higher burden to somewhere that's lower, that may be potentially have a higher risk of transmission. There was a study or basically a commentary done by Dr. Schwartz here in Ontario looking at a flight that came from China to Toronto with 350 people. There was a positive symptomatic case on that flight, and nobody had a secondary transmission that was reported on that case. And people in the vicinity of the traveler were tested and followed up. About 5 became symptomatic, but they weren't actually positive for COVID-19. But nobody else at all had any secondary transmission of COVID. Now that's just one flight that we're looking at. And probably the reason why the transmission risk was low to zero was A, people were masking, and B, the patient had mild symptoms. But we can't mitigate that and say that, there's zero risk in flight. We know that travelers have already played a significant critical role in dispersing COVID-19 across the world that has resulted in the pandemic. In Canada, up until April, 26% of COVID-19 cases reported in Canada were related to travel exposure, and approximately 9% of these were hospitalized. And we know that the risk really is going to be mobility from one region to another that can result in outbreaks. But what exactly is the risk within in-flight transmission? The cases that have been reported have been low relatively, and we're talking about less than 15 cases if you look at the literature, but really this has been from passenger to crew or crew to crew, and these are considered probable or potential because they haven't really been able to really delineate whether this was on flight. There were some cases looking at passenger to passenger infection, which again, there were low in numbers. That being said, there is no single measure that can really reduce the risk of COVID-19 transmission. And so what a lot of the aviation industry is doing is they're looking at where are the risk points in air travel. And that goes from everywhere from booking and deciding to fly to disembarking and traveling home at your destination. And so the idea is to develop a multi-layered system of risk mitigation that can combine to overall reduce the risk. And that's looking at all the different points. And this is from the Flight Safety Foundation, what they call the protected corridor of the traveler, basically looking from every point from online booking to checking in to arrivals, going through security, boarding, in-flight, disembarking, and then again, leaving the airport and getting home safely. So looking at all those touch points to see where can risk be reduced to reduce the risk of COVID-19 transmission. All of these are based on the concept of the COVID-19 golden rules. For any of this risk mitigation to work, people really need to be following the rules. And the main thing is, if you're unwell, do not travel because you would be a risk to potential other travelers in transmission. Maintaining physical distance, so 1 to 2 meters, again, another mainstay in the public health recommendations. Complying with the recommended personal protective equipment requirements that are set out. Minimizing touching of surfaces and your own face to reduce transmission risk. Cleaning your hands thoroughly and regularly, applying proper etiquette in regards to coughing and sneezing, and as well as placing all waste in appropriate receptacles. So where does your risk start? It really does start on your, starts in your decision to fly. The first and foremost question that you need to ask in today's climate is this essential? The Government of Canada currently advises against all non-essential travel outside of Canada, and this is until further notice, actually. The border between the US and Canada is for now closed until August 21st, and likely that will be extended to at least the end of the year. And the other thing to think about is, will your travel insurance cover you if you potentially get sick or if something happens while you are abroad. And the likelihood is if it's related to COVID-19, it likely will not. And if you get sick or if you get caught in restrictions or quarantines or lockdowns outside of the country, or even within the country, you may have your travel disrupted. And again, with the constantly changing numbers and risk being transmitted and the small outbreaks that we're seeing kind of all over, there's new restrictions that may be imposed without warning. Now, if you look at actually the travel restrictions by country, I thought this was actually a really interesting map by kayak.com. So currently 65% of the world's countries are closed for their borders for international tourism. So that's actually really important, again, to really emphasize the fact that non-essential travel is really to be avoided at this point. These are basically looking at the countries where countries are completely closed in general in regards to restrictions for people coming from outside of the country that are not foreign nationals. And then again, if you're looking at some of the countries that may not have any travel restrictions, that may not be due to the fact that they don't have COVID or they don't have risk there, but maybe more to the political side of things and the fact that maybe they just don't have the systems in place to be able to enforce those restrictions. And then again, this is a scary map showing basically the case counts that we're seeing down in the United States versus Canada. And in the US right now, 1 in 100 Americans is infected with COVID-19. And currently they have more deaths than we have cases in Canada. And at the moment, the border is closed until August 21st, and likely that will be extended. And there is talk about the risk of a second wave, and likely we will see that once borders and travel starts reopening here in Canada. So this is a website you can go to the Government of Canada, basically talking about travel restrictions and exemptions and advice, and it basically talks about the global travel advisory that's in place. So the other thing to think about is what are your medical comorbidities that may increase you to susceptibility of risk in flight? And again, these are the risk, the high risk medical comorbidities that make you more susceptible to having more severe COVID-19 disease. And these would still apply to basically being high risk patients for travel. So these would be people that I would not recommend traveling during the state of the pandemic currently. So people with cardiovascular disease, people with chronic lung disease such as COPD or severe asthma, hypertension, uncontrolled diabetes, people who are immunosuppressed, whether they're going through immunotherapy or if they're having immunosuppression from autoimmune diseases, people with active cancers, and obesity is another one that can increase your risk and actually cause more complications while flying. So I'm just looking now at pre-departure risk mitigation strategies. So what is being put in place and what is being recommended? So one of the things is now with the distancing in place and the increased security measures, people are going to be advised to come in earlier and of course not come in with their families, but come in on their own because it's going to take a lot longer to go through the process. So planning ahead for that time discrepancy. It is recommended that if you can check in online to minimize touch points at the airport so that you can have everything kind of ready to go on your phone and decrease the need to be printing paper or touching machines or using kiosks. And the recommendation, again, to use the self-bag drop and even carry-on baggage is really being limited by a lot of airlines. So that would be something to consider looking into, whether that's even being allowed. Symptom screening is the big one. And I think that's really something that travelers need to take some responsibility for as well. If you have symptoms of COVID-19, anywhere up to 14 days prior to your flight, then you should really not be flying. And if you have symptoms coming on, for example, the day of your flight, again, you should not be flying and look at options to either change or delay flying. There will be symptom screening measures at the airport. There will be questionnaires. If you have symptoms or if you've had symptoms in the last 14 days, you will not be allowed to fly. And you may be asked to go home and be quarantined. The other thing to think about is if you develop symptoms while on a flight, you may be asked to disembark. Connecting flights, for example, you may be stuck in a different location because you will not be allowed on a plane if you have symptoms. And the other thing to think about is if you get sick when you are abroad, or have flown somewhere else, and if you're going for a few days to, let's say, BC or Alberta, you get sick there and you're planning to come back, you will actually not be allowed to get on the plane if you have symptoms. You will have to wait out that 14 days. So, something to think about as a consideration for traveling during this time. The other thing is temperature. So they are enforcing temperature screening at airports now, and that basically anywhere 37.5 to 38 degrees. Again, if you have a temperature at screening at the airport, you will not be allowed to get onto the plane. And again, there's going to be enforcing of social distancing, mandatory masking as soon as you get to the airport, and that will continue throughout in-flight. And of course, recommendations for frequent hand washing and disinfection. And this is kind of like a layered approach to the biosafety that they've been recommending through the International Air Transport Association. So thermal imaging technology, looking at more hands-free automated processes, and contactless boarding processes. What about testing pre-flight? We've got a lot of questions, and working at the COVID Assessment Center, where I've seen a lot of people coming in for testing before flying. There are some countries and airlines that require proof of a negative PCR test 2 to 7 days prior to flying. That would be something you'd need to find out from either an international health agency, through the airline, through the embassy or ministry that sometimes are have it as part of their electronic visa requirement, or potentially from a travel clinic. Flying domestically within Canada, you do not need a COVID-19 test done before travel. However, it might not be a bad idea. Again, given that there's risk for asymptomatic and pre-symptomatic spread, it would be a courtesy to ensure that you're not potentially transmitting it to other passengers on the plane. COVID-19 testing is not available at the airport, so it would be done through local COVID-19 assessment center. And remember that if someone or somewhere is asking for a test to be done within 72 to 96 hours, you really need to make sure that you give yourself enough time for those results to come through the assessment centers. Travel is not a priority at the assessment centers, and so these results will not be expedited. So if you come the day of or the day before you're flying, you can't guarantee that those results will be reported in time. And most assessment centers have a link online that you can check your result. You can print them off or to have shown for if you need it to fly. Again, testing is not foolproof. There's about a 30% false negative rate, meaning it could be negative, even though you are positive for COVID. And again, so that's a risk of contagion in flight. And then also, there is also a slight chance that the test results that you have may not be accepted by the destination country, as there are various different tests being used in different countries. And again, if you're testing 2 to 7 days prior to flying and you're not actually isolating yourself as well, there's also a risk of incubation and exposure of the virus that you could potentially be resulting in exposure to other people on flight. What about in-flight mitigation strategies? So likelihood of transmission risk from one passenger to another is likely low. And mandatory masking is going to be one of the reasons for this, is we know that transmission is through respiratory droplets released into the air and onto objects when people cough, sneeze, or talk. So if we look at this photo, for example, you can see that really masking is to protect others mostly from you transmitting the virus to them, but also it can minimize you touching your face, your eyes, your mouth to transmit something that you might have picked up from your hand. So again, another essential aspect is washing your hands frequently. What about the seats? I know there's been a lot of talk in the media about blocking the middle seats to increase distancing. And now the airlines have said, okay, we're putting that up. People can buy that now. So again, if right now flights can be relatively empty, but down the road, that it's not going to be essential for these airlines to block off these middle seats because of the financial trade-off and because it might not be economically viable for them to be continuing to do these flights. So that's another risk factor. Where would you look at being the highest risk? So the middle seat is more about distancing. So can you distance if that seat is full? If you're looking at highest risk in regards to exposure, potentially the aisle is going to be the highest risk, because you're going to have people coming through the aisle. Potentially they might be breathing on you, they might be talking over you, they might be touching your seat surfaces, your back, maybe your hair, potentially. So that would be kind of the area where you're potentially the highest risk. So the window seat itself may actually be the place where you have limit or decreased amount of contact with transmission. Again, with the way the seats are set up, it probably contributes to the fact that there is low transmission on an airplane of COVID-19. And that's usually because of the lack of face-to-face contact, the potential barrier on the back of the seat causing another kind of barrier between other people. And it is going to be recommended that you remain in your seat after boarding. There is this idea that infection risk for respiratory disease is higher on board in the rows, two rows ahead of you and 2 rows behind you. And that's based on the CDC and some of the studies that have been done with things like SARS and influenza. The Public Health Agency of Canada recommends contact tracing for 3 rows ahead and 3 rows behind if there is a case of positive COVID on your flight. And that would be something that on the exposure website that I showed earlier, that you could see kind of where the potential risk of rows were. What about air safety and air quality? I know people were talking about, how safe is the air on a plane? It is very safe, actually. And so if you think about it, the 10 to 50% of air is circulated in the cabin is mixed from the outside air from an airplane. That's about 36,000 feet up, where in that altitude, there aren't really any pathogens that can cause infection. That air is circulated through a series of filters about 20 to 30 times an hour. And those filters, they're called HEPA filters. They're high efficiency particulate air filters, which can capture up to 99.9% of particles, bacteria, viruses. And that's basically in a 0.1 to 0.3 nanometer diameter. And if you look at COVID, it measures only about 0.125 microns, so definitely would be picked up from the filters. Again, the direction of airflow on board from ceiling to floor also limits that radius of distribution of spread. And if you look, this is basically a quick photo showing the air circulation. And again, they're basically restricted meal services, restricted carry-on allowances, limiting people to walk around on the cabin, limiting alcohol on board to reduce laboratory use, for example, to minimize movement, is all going to decrease the risk of transmission in flight. The other thing to think about is, we used to say exercise on a flight, get up, walk around, and really we're going to say the opposite against that now because of the risk for movement and risk for, transmitting virus throughout the plane. So really the idea would be to maybe exercise more in your seat, pump your legs, pump your calves, and consider wearing compression stockings if you have risk or medical risk, and you can talk about that with your family doctor in regards to developing a DVT or blood clot in the leg. Again, it's going to be really essential to practice good hand washing and using hand sanitizer frequently, especially if you've used the lavatory or walked through the cabin at all. As soon as you come back to your seat, you may want to wash your hands. The other thing to think about is disinfection and cleaning. Disinfecting the airplane does not usually happen between flights, much to people believing the opposite. So obviously airlines have increased the frequency and extent of their routine cleaning, but consider bringing your own disinfectant wipes to really wipe down surfaces of high areas of transmission, such as the tray, the folding tray, your armrest, the TV screen, and again, to keep your hands clean frequently, and as well throughout touch points of the airport. So when you arrive, what can you expect? Obviously, you may have your temperature checked again, and if you're positive for a fever, you may be put into quarantine or asked to go to an assessment center. Testing may be done depending on where you are. They may have on-site testing. Iceland, for example, does on-site testing where they'll give you your results back within 24 hours. If you're negative there, you may be allowed to kind of go anywhere. The ArriveCan app is something in Canada which will help you speed up the border process, where you can put in the details of where you'll be staying, contact details and whatnot. And the other thing to think about is transportation, is how you're getting to and from the airport. I mean, the best way to do it is basically having a private transfer of your own car, potentially parking at the airport so that it's there when you return. We really strongly recommend against public transport. And if you need to use an Uber or a taxi, ensure you are using a mask and ensure that the driver is using a mask as well. Again, the other thing to know is what are going to be the requirements of quarantine and if you develop an illness. And in Canada currently, there are emergency orders under the Quarantine Act. If you return to Canada from abroad, you have to quarantine for 14 days on arrival. And it needs to be in a place where you need to isolate from anyone who potentially may be vulnerable, such as those over 65 years of age. There's huge penalties associated with providing false information or breaking quarantine. And the Contravention Act has given police and RCMP more authority to follow up and do spot checks and fine people as well. And remember, if you have a negative test post-travel, it is still mandatory to quarantine for 14 days in Canada. And the reason for that is potentially the risk of false negatives, as well as you can have an earlier on a negative test and then develop symptoms and then be positive later on in that period. So the ArriveCan app has information in regards to that as well. And what about contact tracing? So if you develop symptoms within 14 days of arrival, you should notify the airline, and that can be done through the app as well. But really, you should be contacting your physician who can contact public health. If there is a positive case on a plane, you will not be contacted by the airline. So it is really important, unfortunately, to be following up, checking on the government websites during that 14-day potentially, and following kind of the public health updates in regards to it. If there is a positive contact, you may or may not be contacted. Other things to think about for future considerations is the idea of widespread pre-testing. So that would only be allowed or efficient if there was high speed, scale, and accuracy for testing, but that's something that might be a safe way to reopen travel in the future. The other thing is in regards to antibody testing. Right now, really all the antibody tests will show us if you've been exposed. It really doesn't show or tell us much about immunity at this point because we're too early in the game in regards to the pandemic and the amount of time that this virus has been around. But you know, down the road, if we're starting to see immunity kind of maintained, then potentially there may be the presentation of having something called an immunity passport, something similar to the yellow fever international health regulation certificate that people can use when they travel and say, I'm immune. And so you may be able to bypass the screening protocols and or you may not be needing to use that, for example, a mask or whatnot on the plane. So that's going to be something to kind of watch this space. And again, it really will depend on how things play out in regards to the other thing this may be relevant and useful for is if there is a vaccine that's developed, will that be associated with a part of an immunity passport as well? So again, don't travel if you're sick or exposed to someone positive in the last 14 days. Avoid non-essential travel. Plan, you may want to consider carrying multiple masks, hand sanitizer, and wipes. Check with your travel insurance. Consider, carrying an extra change of clothes in case there is and likely will be a change or diversion in flight plans. And then again, talk to a travel expert to seek pre-travel consultation on other vaccines and destination-specific information and risks. And remember, not all symptoms post-travel are related to COVID-19, so that also may need to be assessed by a physician. Great, and that's it. Thank you for joining us today.
Thank you so much, Dr. Khatib. That was wonderful. We do have lots of questions. Let's try to get through these, I don't know, in about, I think we have about 10 questions at this point. So let's try to get through these, within say 10 minutes or so. Okay, this one's a quick one. If you have one of the medical conditions, should you stay home? So I think this question came in as you were talking about risk factors for that would indicate higher risk for COVID. So if you have one of the medical conditions, should you stay home?
So I think generally everyone should be really avoiding any non-essential travel at this point, but definitely those who have any of the comorbidities of the medical issues should definitely really stay home and not be traveling during this time because they would be higher risk of contracting a more severe form of COVID-19.
I am a healthy 60-year-old and our daughter wants us to fly to BC in September. What do you advise? I know to make sure with Air Canada to ask for a domestic flight only and not one coming from abroad.
Yeah, so again, I think it really comes down to what is your risk tolerance, and the recommendations to make sure you're following the protocols of the airline, and public health as well. I would look at trying to avoid any connecting flights to decrease your airtime and airport time. Avoid really spending a lot of time in the airport, washing hands frequently, maintaining mask, and then again, really maintaining distance as well during the whole kind of journey, as well as monitoring for symptoms post-travel, and monitoring as well as on the exposure contact risk. For example, if there is somebody with a positive case on your flight, then depending on where you're sitting or depending on where the exposure was, you may need to consider isolating, because you would be considered an exposure risk to somebody who's been a positive case.
It is getting to that time, though, where parents who maybe live in different provinces from their children are getting anxious to see, grandkids and things like that. I know that's certainly a factor in my family, and in terms
Yeah,
of
understanding for
big city
myself as
travel.
well. My mom's in Alberta, and it's the same thing. It's a hard time for people being isolated during the pandemic, but at the same time, you really have to weigh up the risks of what are the risks of you potentially transmitting from one place to another, but also the in-transmission risk, and then mostly the exposure risk. It's not so much the in-flight transmission, it's the exposure, and what that could result in.
Perfect. This is a fascinating question. So on the issue of people being over age 60 being considered higher risk, are they still higher risk if they are exercising regularly and are very fit? Some people over age 60 are much fitter than many younger people. Is the level of risk more a question of fitness level versus age, age alone?
I think it really looks at, if we're looking at numbers of the COVID-19, we're looking at those who have more severe complications from COVID-19. I mean, the most severe and they're likely to be hospitalized are then those over the age of 80. And again, those over the age of 60 are more likely. And I think it does make a difference, because if you look at the correlation of people over those age ranges, they're likely to have more medical comorbidities. And so probably that's the correlation. So definitely if you're, more healthy, you're more likely to, you may or may not have a more severe disease. That being said, remember, this virus has hit all age groups. And so there's no age or health kind of a requisite, essentially, right? We've seen really sick people in their 30s, 40s, who have been put on ventilators, who are completely healthy before. So it's hard to predict, and you can't really say one or the other. The risk is there. It's just more, those are the categories that we've seen more severe complications of COVID-19. So it's not the other way around necessarily. It's more kind of what are the stats, and can that be kind of pushed out to the general population. So definitely, I think if you're healthy, if you're exercising, but also more importantly, if you're following recommendations for social distancing and frequent hand washing, you're probably going to be safer in that regard.
We have several questions about washrooms on planes. Are there any special considerations beyond, trying not to touch, try to touch as few surfaces as possible, and then wash your hands afterwards?
Yeah, so it's interesting because I read a paper looking at fecal transmission of COVID-19, and that there has been evidence of virus being shed in the feces. And so potentially, is that a risk point? So actually, the paper was looking at tracing airplanes by testing the feces online to see if potentially somebody had positive COVID on that flight. So that was a way to see if there was positive COVID. So it's a really interesting paper. But again, I think really people really need to make sure that the highest touch points in the bathroom are going to be the toilet flush, the door, the sink. So if you're going to be using it, potentially maybe using some tissue to use those touch points, washing your hands. When you come back from, if somebody else hasn't washed their hands, avoid touching the side seats. And again, when you get back to your seat, using hand sanitizer. That's a really important point, is when you get back to your seat, cleaning once more.
is it a good idea? Oh, wait, actually, does the Arrive Can app only need to be downloaded upon returning to Canada, or else do you have to download it if you arrive in another country?
No, that's only on arriving to Canada. That's when if you're returning to Canada. Other countries they may have different forms that they are getting, like electronic visas, or they may have like paper forms, but they are all, like for example, Hong Kong has a electronic wristband that they'll put on you to monitor you, to be able to trace you. Taiwan and South Korea are using Bluetooth apps on their phones for tracing after people have landed. So there's different countries are using different ways to be able to contact people afterwards.
Is it a good idea to wear gloves on a plane?
Generally, I think the recommendations for glove use are not for the public to be using it. And the reason for that is that you're likely, when you're using gloves, to get them soiled and then touch yourself with it, right? And so if it's a one-off use, then definitely you can decrease the risk, but you're better off actually just frequently hand washing, because you're actually going to be removing those bacteria and virus by cleaning your hands with sanitizer. Whereas with gloves, you're actually just continuously picking up more and more, and your gloves are actually going to be a contamination point for yourself.
Do you expect the 14-day quarantine requirement to be relaxed at some point in the near to mid future, especially if coming from countries with lower rates than Canada?
So that is something that will be kind of debated on coming into the future. Right now, that Quarantine Act is put in effect until the end of August, and likely it will be extended. And like I said, one of the reasons for the Quarantine Act in place is it's a protective measure, as well as one to kind of being able to monitor yourself. So for example, if you are exposed to somebody and you're going to be shedding, you're more likely to be shedding in the 14 days or transmitting in the 14 days. So if you're quarantined, you're less likely to do that. You're also more likely to develop symptoms in those first 14 days. So the problem with testing is, if you come in and say, let's say 3 days or 2 days after a flight, you get tested, you're negative, and then this is a case I actually saw, and then in 9 days you develop symptoms and get tested at day 9 and you're positive, then you might have false assurance from that first negative test that that you are negative, and you may be kind of going about transmitting the virus. So I think until we get better testing that's a little bit more reassuring, that I think the quarantine will be in effect. And I think it's really important to look at other countries as well. Like for example, Iceland, if you have a negative test when you get there, you do not need to quarantine for 14 days. So for now in Canada though, that's mandatory. And if you don't follow those rules, even though you have a negative test, it's a high penalty.
Okay. How does the latest reporting on COVID being airborne affect this presentation?
So, I mean, one of the things that you look, for example, one of the studies showing on CMAG showed that there was, zero risk of transmission to secondary cases after there were a symptomatic traveler, and they tested the people around, 25 people around that symptomatic passenger as well as others. Likelihood is that the risk of transmission was decreased or zero because of masking. And if you look at the transmission for COVID-19, we know that it's transmitted through respiratory droplets, right? If you look at other respiratory infectious diseases that potentially can be contagions on airplanes, there is a 2-seat rule that's been used for planes. For example, if you're in the 2 seats in front or 2 seats behind, you're more likely to be at risk for contagion from a respiratory disease such as SARS or TB or influenza. And part of that is also to do with the airflow. Remember, the airflow it's a high airflow that's going downward. So there's no laminar airflow in the airplane. It's all going down and it's being filtered downwards. So it's really going to be like the area a couple seats in front and below. So behind. So even if even if this was transmitted through airborne, which we know right now it's through respiratory droplets, the risk is a lot lower. And even if you look at the studies done for influenza and SARS on infectious risk on airplanes, which potentially may have more airborne transmission than COVID-19, specifically to SARS or potentially TB, even then there hasn't been cases that have been really reported beyond more than a few seats behind and in front.
Okay, just we're coming into the final bit. People are still submitting questions, but I think we're going to have to wrap this up soon. So I had a false positive result last week, and it turned out to be a data entry error. Have you seen this elsewhere? So this would be a question, I guess, more specifically relating to your experience as at a COVID-19 assessment center.
It wouldn't really necessarily be through, I wouldn't know how to speak to that, because it would have to be the people who are entering the data and the public health agencies. Yeah, sure. So yeah. Okay. I haven't seen that before.
Where did you get the wooden globe behind you on the wall?
So there was actually a fair trade market, basically artisans, just at the center. Like they basically, there's like all these trade shows that happen, but he's a local artisan who basically does this by hand. So if anyone wants the contact for that, contact me. I'm happy to send you his email. He does some fabulous work, beautiful stuff.
Okay, that's fantastic. Somebody also asked, okay, that's going to be it. We're going to wrap up. Somebody asked, how can I get a copy of the slides? And that actually is a pretty good segue into our next, let me just move forward through this and one more. Okay, so we have other resources. So Dr. Khatib did a podcast on how to fly, which is a great resource. That's an interview with Dr. Vincent Poirier, who is a medical advisor to both Air Canada and Air Transat. You can find that bit.ly/medcan_podcast, or the actual link for the podcast is there. We post all of our webinars on Medcan's YouTube channel. That's youtube.com/MedcanLiveWell. If you just search Medcan on YouTube, you find that as well. And so, yep, we have the future webinars next week, the second wave of COVID-19 with Dr. Peter Norda and Andrew Zamakis. Then we have the relationship in the time of COVID-19 with Dr. Gina DiGiulio, Dr. Jonathan Danton, and Dr. Amanda Beeman. Dr. Khatib, thank you so much for this. Any final summing up words of wisdom?
I would just have to say that it's not a good time to travel, for non-essential reasons, and I think people should really take that into consideration. But obviously, there are things that will be kind of more essential and more important, and potentially the risk of flying domestically currently within Canada will be lower. But again, I mean, as we see kind of little outbreaks pop up here and there, I think people just need to be cautious, and it may be worth considering getting pre-tested. Just because maybe you can help decrease the risk of spread throughout the country.
Well, we did. So there was that one question, and actually they submitted it before, so we should ask. So, sorry, I'm throwing a spanner into the works here, but there was that one question about the person in Barbados who their son was thinking of traveling, and Barbados requires a test done within 72 hours. And you said in the podcast that while you can't get an expedited result because of travel, on account of travel, you said that most results are coming within 72 hours, but really try to get it, if you have the 72-hour window, like get it on that 72 hours out.
Yeah, so the turnaround times are pretty good for the assessment centers and the testing centers in Ontario. So I would say like the longest people are probably waiting is about 96 hours, but most of the time the turnaround time can be anywhere between 24 to 48 hours, depending on where you're getting tested and the volume. So again, if they recommend that 72 to 96 hour window, I would go 72 to 96 hours before your flight. Again, though, it's not guaranteed that you will get that result back in time, but you most likely will.
Okay. All right. Thanks to the webinar attendees. Thank you very much, Dr. Aisha Khatib. Everybody, if you are considering air travel, bon voyage and best wishes. And here's to safe travel in the future. Thanks very
Thank
much.
you.
Have a great week, folks.
Take care.